Hello, good day. This is Dr. Toon, and welcome back to the MedGuru CDB YouTube channel. For today, we're going to talk about a very important organ in the gastrointestinal system, which is the appendix. Everything I'm going to teach you in this module is going to teach you the must-knows, the clinical pearls, which you have to know for any upcoming examination and your clinical practice. Now, we'll be applying the curriculum at Cracking the Boards Review Center, wherein we will be bridging, integrating several references so that you can holistically approach an organ system. These are the following references I'm using for this video. So we have anatomy, histology, surgery, pathology, and medicine. Now, this is lifted from your Netter's Atlas of Anatomy, and this is showing you the appendix here. This is the cecum, and if you notice, you have the blood supply there, which is the appendicular artery, and you have your famous Taenia coli, which I'll be mentioning in detail in about a minute. Now, let's start with the basics. What should we know about the histology of the appendix? So the epithelium of the appendix is simple columnar epithelium. This is the simple columnar epithelium here, okay, in the appendix. And let's go into detail about the mucosa of the appendix. So as mentioned earlier, the appendix has simple columnar epithelium. It has prominent goblet cells. The lumen is stellate or star-shaped. The submucosa is loaded with lymphoid follicles or lymph nodules. The muscularis externa will show inner circular and outer longitudinal smooth muscles. So the muscularis externa has ICOL, I-C-O-L, inner circular and outer longitudinal smooth muscles. Now, what I would like to emphasize on, two things for your exam. One is the simple columnar epithelium. Two is the lymphoid follicles. Now, here is a cross-section, a histologic cross-section of the appendix. This is your lumen. And as mentioned earlier, the lumen is star-shaped. These are your lymphoid follicles. See this? Another lymphoid follicle. Another one. The arrangement of the lymphoid follicles, they are aggregated surrounding the lumen. So once we have the histological pearl, that the lymphoid follicles will surround the lumen, this is what we call the confluent nodules. Okay, the confluent nodules. And this is unique for the appendix. So the confluent lymph nodes, if you look at where the red arrow is, so here at the tip, lymph nodules, it surrounds the lumen of the appendix. Now, master this for your exam. The histologic criterion for the pathologist to diagnose appendicitis. Now, we know the most common condition associated with the appendix is appendicitis. So this is the histologic criterion which all medical students and doctors in training must know for their written examination. Neutrophilic infiltration of the muscularis propria. So the histologic criterion for appendicitis is neutrophilic infiltration of the muscularis propria. Now here, you notice all these neutrophils here, or in layman's terms, all these dots. So this is the marked neutrophilic infiltration of the appendiceal wall. So the diagnosis here would be acute appendicitis. So the magic word is neutrophilic infiltration. Now, another histologic pearl I want everyone to remember. there is a group of cells which is located at the base of the appendiceal crypts. And this is what we call the argentophene cells, or, this is a tongue twister, Kolchitsky cells. So again, what do we call the specialized cells which are found at the base of the appendiceal crypts? These are your argentophene cells or your Kolchitsky cells. These are actually neuroendocrine cells. These are the cells that give rise to the carcinoid tumors. Now, please remember, common location for your carcinoid tumor would be the appendix. So the argentophene cells or Kolchitsky cells give rise to your carcinoid tumors. Now, another anatomical pearl which I want everyone to remember. The position of the adult appendix is found in the posteromedial aspect of the cecum. So the position of the adult appendix is at the posteromedial wall or posteromedial aspect below the ileocecal valve or the cecum. Now please remember, the most dilated portion of the gastrointestinal tract is the cecum. Below the cecum or the ileocecal valve, posteromedial aspect, would be the appendix. So please take note, I highlighted posteromedial. Now, what is the most common location of the appendix? There are several locations of the appendix, just to name a few. It can be retrocecal, which means behind the cecum. It can be ileal or towards the ileum. It can be towards the right, or it can be pelvic in location. So the most common location of the appendix is retrocecal. So this is another pearl to bring with you to the exams. Now here, this is from teachmeanatomy.com. So just to enumerate the variety of the location of the tip of the appendix, it can be retrocecal, subcecal or below, pelvic, pre-ileal, or post-ileal. Most common is still retrocecal. Now, just some structures I want you to be familiar with, and please don't forget to watch our other YouTube videos on the gastrointestinal tract. So here, this is the cecum. Enlarge the ileocecal valve. Then you have the ascending colon, the transverse colon, the descending colon, until you end up with the sigmoid colon. Now you have the haustra, which are the dilated sacs in the large intestines. And here, now this is where we're going to focus. You notice this longitudinal bands of muscle here, okay, which is unique for the large intestines. This is the taenia coli. So we have the taenia coli. Then we have the lobules of fat. So let's enlarge this. There you go. Those yellow lobules of fat. This is also specific for the large intestines. This is what we call the epiploic appendages, or the appendices epiploicae. Now, let us take note that the taenia coli, there's actually 3 distinct bands of smooth muscles that will run longitudinally along the large intestines, and this is your taenia coli. This is a distinct feature of the large intestines. So the 3 taenia coli will converge at the appendix. And this is a surgical pearl because this will help the surgeon identify where the base of the appendix is. So these are your 3 taenia coli: mesocolic taenia, the omental taenia, then we have the free taenia. So we have down here mesocolic taenia, free taenia, and we have the omental taenia. Now, so this is what you have to memorize. There are three taenia coli: mesocolic taenia, omental taenia, and free taenia. So if we go textbook, this is taenia omentalis, that's the omental taenia. Taenia mesocolica, this is your mesocolic taenia, and your taenia libera, that is your free or your liberated taenia. Now here, beautiful illustration showing you the taenia coli here. Okay, this is your haustra, the sacs, and if you notice, the appendix is epiploicae, okay, lobules of fat. Now let's go back to this illustration lifted from Netters. So you have here the taenia coli, omental, and the taenia libera. Okay, the third taenia is not seen in this view. However, oh, here it is, the mesocolic taenia. So omental taenia, and down here, if you zoom in, this is your mesocolic. All three taenia will converge at the base of the appendix. Now, this is the pearl you have to remember. The three taenia coli will meet at the base of the appendix, and the anterior taenia is used as the landmark to identify the location of the appendix. So if you notice, I highlighted letter A, okay, for anterior, and letter A for appendix. So it's the anterior taenia, which is used as a landmark to identify the location of the appendix. Now, blood supply. This is the appendiceal artery. Okay, that's kind of easy to memorize. What is the blood supply of the appendix? So, the appendiceal artery. But trust me, in an exam, they're not going to ask you that. They're going to ask you, where does the appendiceal artery arise from? So, it's the posterior cecal branch of the ileocolic artery. Again, the blood supply of the appendix is the appendiceal artery, and this is the posterior cecal branch of the ileocolic artery. Now here, again from Teach Me Anatomy, so this is the ascending colon, the cecum is down here. Look at the appendix. Okay, this is the ileocecal artery. Okay, posterior branch, the ileocecal artery. So this is now your appendiceal artery, which supplies the appendix. Now here's the ileocolic, and there's the appendiceal artery. Now please take note of this structure known as the mesoappendix. So this is the mesentery which covers the appendix. Now for the lymphatic drainage, we have the ileocolic lymph nodes. So we have the upper group here, the ileocolic nodes, then the lower group of the ileocolic nodes. So the lymphatic drainage of the appendix is the ileocolic lymph nodes. Now for the etiology and pathogenesis, the most common cause of appendicitis is a fecalith. So it's the fecalith which causes the obstruction. Now other causes of appendicitis can be 1. Lymphadenitis, especially mesenteric lymphadenitis, which is common in children. Parasites, such as Enterobius as well as Ascaris, can also cause appendicitis. Tumors can also cause appendicitis. So the fecalith. Now here is a borrowed picture of your fecalith. So here, right there in the middle, the fecalith. Now, when you have appendicitis, this is commonly asked in exams and, of course, in the bedside. What is the first symptom of appendicitis? It's usually anorexia. So the absence of anorexia would make you doubt the diagnosis of acute appendicitis. So anorexia is usually the first symptom, and anorexia precedes the pain. So anorexia, common in 95% of patients. Then we have abdominal pain, then we have vomiting. Okay, anorexia, abdominal pain, then we have vomiting. Now let's proceed with the pathophysiology of acute appendicitis. So everything starts with obstruction of the appendiceal lumen. As mentioned earlier, the most common cause is a fecalith. Once you have obstruction of the appendiceal lumen, what happens is the appendix will constantly secrete mucus, leading to the buildup of mucus in the appendix. Both the obstruction and buildup of mucus in the appendix leads to increase in the pressure of the appendiceal lumen. This increase in the pressure causes ischemia. Decreased blood flow to the appendix now results to hypoxia or decreased oxygen delivery, and this decreased oxygen delivery or hypoxia leads to the ulceration of the appendiceal mucosal lining. Once you have the ulceration, you will now have microbial invasion, which is usually poly or multimicrobial, with two bacteria I want you to memorize. We have E. coli, then we have Bacteroides fragilis. After the microbial invasion, there's going to be inflammation and swelling of the appendix, and voila, you have your appendicitis. Now, here is a table showing you the bacteriology of perforated appendicitis. So what are the most common bacteria which are found or which cause acute appendicitis? As mentioned earlier, it's usually polymicrobial. You have anaerobes as well as aerobes. But there are two I want you to memorize by heart for examination and clinical practice purposes. We have E. coli, then we have Bacteroides fragilis. Now, what about the pain which you experience in appendicitis? There's cutaneous hyperesthesia because of your spinal nerves, particularly T10, T11, and T12. This will also explain to you the referred pain that we have from the epigastric area as well as the umbilical area, which will radiate classically to the right lower quadrant. So T10, T11, and T12. Now, some physical examination pearls regarding your acute appendicitis. So first is your Dunphy's sign. You simply instruct your patient to cough and the patient will experience pain on the right lower quadrant upon coughing. The psoas sign, pain, upon extending the hip with the knee in full extension. This is indicative of acute appendicitis. So here. Now, what about Robson sign? So when you palpate the left lower quadrant, this will cause pain in the right lower quadrant. And when you have Robson sign, this is indicative of peritoneal irritation. Now, winding down, we have Marko sign. So this is the heel jarring test. So as you can see, you let your patient tiptoe, and standing on their toes, you ask them to suddenly drop, the heels with a jarring landing, and they're going to experience abdominal pain. So this is your Marko sign or your heel jarring test. Now, winding down, we have the Alvarado Score based on the signs, symptoms, and laboratory values. So take note. Right lower quadrant tenderness, these are your variables. Fever, rebound tenderness, symptoms of anorexia, nausea, vomiting, migration of pain to the right lower quadrant, laboratory findings of leukocytosis or increased WBC with predominance of neutrophils. Now, your reading assignment is to read what is the score, which tells you that this is most likely acute appendicitis. So lastly, for the management, it is surgery. So appendectomy, the most common surgical emergency in adults is acute appendicitis. And the most common acute surgical emergency in pregnancy is also appendicitis. So with this, I hope you have been able to integrate the different subjects and medical textbooks about the appendix, and feel free to repeat the video, supplement with your personal readings. So don't forget to subscribe, okay, to our channel. And let's end up this module with some must-know questions. What is the most frequent site of rupture of the appendix? It is the anti-mesenteric border. What is the most frequent site of rupture of the appendix? It's the anti-mesenteric border. So let's end up with these brain exercises. Now, what is an ambient hernia? This is when the hernial sac contains a ruptured appendix. So your hint here is letter A for ambient is letter A, appendix. So what is an ambient hernia? This is a hernial sac that contains a ruptured appendix. Now, winding down, tumors in the appendix. What is the most common site of GI carcinoid? It's the appendix. It's usually located at the tip of the appendix. If you recall earlier, we mentioned the argentophene cells or the Kolchitsky cells as the source of your carcinoid tumor. That is also known as your enterochromaffine cells. Now, another cancer of the appendix is your adenocarcinoma. So we have the mucinous adenocarcinoma as well as the signet ring cell carcinoma. The signet ring cell is rare and it has the lowest survival rate. Treatment for adenocarcinoma of the appendix would be a right hemicolectomy. So it's not just merely an appendectomy, but you have to perform a right hemicolectomy. And lastly, what is the diffuse collection of gelatinous fluid and mucinous implants on the peritoneal surfaces and omentum? This is known as pseudomyxoma peritonei. So the diffuse collection of gelatinous fluid and mucinous implants on the peritoneal surfaces and omentum, pseudomyxoma peritonei. So take time to review the video. Don't forget to push the like button, share the video, and tune in for the other future videos of the MedGuru CDB channel. This is Dr. Toom saying thank you, study well, peace, and God bless. Salamat.